Action.
Good morning, Isabella. I'm Cheyenne. I'm your student nurse. I'm here to take care of you and show you how to do a dressing change.
Okay.
How is everything feeling? Do you have any pain?
I'd say the pain's about a 2 to 3.
2 to 3?
Yeah.
Okay, that's good. We usually like to catch you at a time where it's not causing so much pain, so this is good. Are you okay if we do a dressing change?
Yeah.
Change your dressing?
Yeah, sounds good.
Okay, perfect. So what I'm going to do is I'm going to do a couple of different teaching methods. The first thing that I'm going to do is I'm going to explain and demonstrate at the same time how to do a dressing change on myself.
Okay.
That way you can, see it. And then I'm going to have you state that back to me just so that I know, you know how to do it yourself. Does that sound good?
Yeah.
Okay. Alrighty. So the first thing that we're going to do is I'm just going to go through all the supplies that you need. So you're going to need a bedside table just to put all your supplies on. And then you're going to need a little wipey so you can wipe down the table before you put the supplies on. You need a dressing, hand sanitizer, a little bit of alcohol wipe, 3 gloves, and 3 ChloraPrep swabs, which is going to help clean your incision.
Okay.
Okay. Alrighty, so I'll just go ahead and start with the process of how to do a dressing change.
All right.
So the first thing you're going to want to do is we'll wipe down this table just to get it clean. And then we'll just put the supplies on here right away. All of them. So it's clean. So it looks like we got everything. And then we're just going to wash our hands. And then we're going to put gloves on. And then we'll be able to get the process started. Okay. All right. So you wash your hands and then you put your gloves on. And then we're going to get started on how to do this.
Okay.
Okay. So I'm just going to lift this up so I can show you better. All right. So the first thing you're going to do is your dressing is going to be on. So we're going to take that dressing off. So you're going to want to peel it off slowly and start around the edges and just kind of peel upwards, all the way around, kind of like this. And then if you do find an area where it gets caught, like you can't lift it up as easily, that's when you would take like an alcohol wipe. If you don't have alcohol wipes, maybe just grab like a paper towel that's wet and then just kind of wipe it on the actual dressing itself.
Okay.
And then that way it'll help take that dressing off. So then you'll lift the dressing and then you're going to set it aside. So then we'll take off our gloves and we can wash our hands. And then you're going to assess your actual incision area. And actually, when you do this process, I have a handout for you, and it goes through like signs and symptoms of wound infection. So this is a very, very important part. After you take that bandage off, you're going to want to look at the incision and look for these particular things that could happen, and it could represent infection.
Okay.
So that would be like dressing or drainage that comes from either this or that could be on your dressing. Redness around the wound, swelling, if it feels warm, or like an odor, like a smelly odor. So this is for you.
Okay.
I'll keep that for you. So you're going to look at the incision and actual look at the dressing itself before you throw it away.
Okay.
Okay?
Yeah.
So once that's done, I washed my hands, and then we're going to put on the second set of gloves. Okay. So then after you put the gloves on, the next step is to clean the incision. So that's when the 3 ChloraPrep swabs come into play. So you're going to take your first one, and you always want to go top to bottom, and you're going to go from inner to outer, okay? And you're going to start on one side first. So you're going to just go like this and kind of clean, going downward. You never want to come back up. Then you can throw that away. And then you can take this next one, and then you're also going to do the same thing, going down the other side, top to bottom. And then this last one you're going to do, and you're going to go right down the middle.
Okay.
So you're just going to go gently down. You don't want to go very hard. And once that's done, should be clean. And then you're going to take off your gloves. You can throw those away, wash your hands. And then you're going to put your last gloves on.
Okay.
Okay?
Yeah.
The washing your hands is very, very important in putting new gloves on, just to help keep it clean. Okay, so then after you have your last pair of gloves on, we're going to put the dressing on.
Okay.
So I'll take it out of its package, and it's going to be almost like a Band-Aid. So you're going to peel off one end, and then, you know, just place it on, and then you can kind of take that other one off.
Okay.
And then it's going to just place like a Band-Aid, and you just place that right over your incision.
All right.
And once that dressing is on, you can take off your gloves and wash your hands.
All right.
Okay? So I'll just go ahead and wash my hands here. Did you have any questions about the dressing change at all?
No, that seems to make sense.
Okay, all right. Do you feel like you'll be able to do this?
Yes.
Okay, all right. I'll just have you instruct me then on how to do it. Okay? All right. I'll just kind of... And before I have you teach me how to do the dressing change, I'll take this off.
Okay.
You will no longer have this on.
Okay.
You're just going to be sent home with just the dressing itself. Okay?
Okay.
Alrighty, so then whenever you're ready,
Right.
I'll just go ahead and have you kind of explain how to do that.
Alright, so I'm gonna use a disinfectant wipe, and I'm gonna wipe down the table that I have. Wipe it down good, and then just put my dressing and my swabs, alcohol pad, sanitizer, my 3 gloves. And then I'm going to wash my hands. Sorry. And then I'm sorry.
It's okay. The gloves are hard to put
Yeah,
on.
they're like sticky.
They tend to stick.
Alright, and then
Good.
just gonna peel off the edges. And you said if I have any hard times with any of the edges, I can use alcohol.
Yep.
Wipe to help lift off any sticking parts onto the dressing. I'm gonna take it off and set it aside. I'm gonna assess my incision and just make sure there's no infection, swelling, or drainage of any yellow or any like odor. And I'm gonna look at my dressing too, and I don't see anything. So
Okay.
I'm gonna take off my gloves and wash my hands again. Put on my second pair of gloves. And I'm going to use the swabs. I'm going to clean from the top to bottom, from inner to out. First doing my one side, and then doing the other side, from inner to out. And then the last one I'm going to use to just go from top to bottom. Then I'm going to get rid of these gloves and wash my hands again. And then put on my last pair of gloves. And then I am going to open the new dressing. And then just going to take off the one side, stick it on, peel off the other, and
Place
be
on.
good to go.
Yep.
And
Perfect.
Then, yeah. Then throw out my pair of gloves and wash my hands.
Perfect. Good.
Awesome.
Do you have any questions on anything with that?
No. Feel pretty comfortable now.
Feel comfortable? You feel good
Yeah.
to do it at home by yourself?
Yeah.
Okay.
Feeling, yeah.
Good. So then actually I will be sending you home with brochures and just documents on how to do all this stuff.
Okay.
So this is going to be a step-by-step on how to actually do the dressing change, just in case you forget. You have this to look back at.
Okay.
So you have the infection sheet, this as well, and then I'll also give you a sheet that explains all the supplies that you're gonna need, and like pictures, just in case you may forget what they look like.
Okay.
Okay?
Yep.
So you have all that to take home with you. Alrighty, so next, alrighty. Now I'm just gonna go ahead and start with like the discharging or discharge. Is there anything you had questions on about any of that before we get into discharge?
No, at first I was scared, but now that we went through it, I feel comfortable to do it by myself.
Feel a lot better?
Yeah.
Okay, good,
Yeah.
good. I'm glad you're not scared. It always helps to do it before you go home.
Mhm.
Makes you feel more comfortable.
Yeah.
Okay, so then I'll just go ahead and just say a few things. The instructions, I'll actually give this with you to go, so you'll take it as well. You'll take it home.
Okay.
But I'll just go over a few things with you. So when you get home, and you know, when you first start to shower, your doctor is actually going to be the one to clear you in order to shower, so you'll have to wait for his word. He'll clear you, and when you do get cleared to shower, there's a few things that you're going to want to know. When you do shower, you're going to want to make sure that you're in a chair or just, you know, something to sit in, just so it's easier for you to, you know, access that wound and clean it better.
Okay.
When you are cleaning the wound, make sure that you're not rubbing it vigorously. You're gonna, you know, wipe it gentle and with warm and soap.
Okay.
And also just make sure that when you pat, like you're patting it dry.
Okay.
And keeping it dry is very, very important. When you have something moist, it's still a little wet, and you put the dressing back on there, that kind of, you know, it's an easy area for bacteria to form. So just make sure that it's dry.
Great.
So that'll be, you know, for the shower, and again, your doctor will clear you for if you, for you to be going into hot tubs, bathtubs, or even pools. Okay?
Yep.
Alrighty, so then with medication, your pain meds, they tend to make you drowsy. We all know that you shouldn't be behind the wheel anyways, physically. But the pain meds will make you drowsy. So just kind of keep that in mind. You're not going to want to be doing any, you know, heavy lifting or just anything that's vigorous activity.
Okay.
So just, you'll hear from your doctor as well. He'll clear you, and then you'll be able to drive again. Usually that's about 6 to 8 weeks. So
Okay.
keep that in mind. And then also when you're sitting, just like at home, you know, you're watching TV or whatever, maybe sit like in a chair that has arms. And I say that because when you get up, it's just easier for you to get yourself up, and, you know, it makes it more stable and, you know, less likely to fall.
Okay.
And when you're sitting, try not to be sitting for long periods. Maybe do like 30-45 minutes. That way, you know, it's not going to cramp up or get stiff. That way it's just, you know, you're moving it around a little bit.
Okay.
And then when you're sleeping, try to sleep with it underneath your ankle versus the actual knee itself. Gives your knee a little bit more wiggle room, and it doesn't cause it to be stiff or more pain in the morning. So, you know, maybe throughout the night, just kind of try to move it a little bit, you know, wiggle it a little bit, get that blood circulation going. And
Just like an alarm or something.
yeah,
Okay.
exactly.
Yeah.
Yep. And then also when you're walking up the stairs, you know, take it one step at a time. Use the railings if they're there, or if, you know, someone else is there, maybe have them be behind you just in case.
Okay.
And then lastly, if you do go home with any crutches or anything, you know, try to use those. And your doctor or PT will clear you, and then you'll be okay to walk on your own. And lastly, when you're at home, just try to make sure that things are cleared out of your way. You know, like in the hallways or going to the bathroom or something, just make sure that it's out of your way.
Okay.
And when you are sitting, just make sure that, you know, your valuable things like a phone, just in case something may happen, just make sure they're close to you.
Right.
Okay?
Yeah.
And just, you know, another thing, if you do have shortness of breath, chest pain, or maybe like a tenderness or like a pain in the back of your calf, that could indicate a blood clot, pretty serious. Could indicate something else as well. But if you do feel any of those, make sure to call your healthcare provider.
Okay.
Okay?
Yeah.
Was there anything on here that didn't make sense or you have questions about?
No, that all makes sense.
That made sense?
Yeah.
Perfect. So the last thing that we typically like to ask before we discharge you, are there any barriers that you may think of that could affect, you know, the healing process or you learning how to take care of your wound? Like, do you have any stress at home? Is there any fear, pain, lack of support, anything that I could help you with or refer you to someone?
No, I have a good support system with my husband. And
Okay.
Yeah, feel comfortable going home.
Okay. Perfect. Well, I guess I'll send you home with all these, you know, brochures and all this paperwork.
Okay.
All that's there for you. But if you have any more questions, just call your healthcare provider, and I hope you have a good recovery.
Awesome. Thank you so much.
Yeah, thank you.
Yeah.